We're heading to India, where the Health Ministry has announced that the daily Covid-19 caseload has risen by over 27,200. That means that the total number of infections across India stands at well over 33 million, with the death toll standing at close to 443,000. Now, according to one database, India has the most partly immunised people in the world, with just 19% of the population now fully vaccinated. For more on the outbreak in India, we can speak now to Rajib Dasgupta, who's the chairperson at the Centre of Social Medicine and Community Health in New Delhi. Thank you very much for being with us here on France 24 this hour. First of all, we saw a surge in both cases and deaths in April and May of this year, but now the infection and fatality rates have been falling sharply across India. How can we explain that?
Hello, good evening, Thomas. Essentially, what happened in April and May is the surge on account of the Delta variant, which the rest of the world, or much of the rest of the world, is now experiencing. And the Delta really swept through the country, bringing in its wake enormous number of cases and deaths. There have also been, as we now know, based on Sero survey results, a fair amount of undercount, which is the number of cases actually diagnosed versus what's been missed for each diagnosed case. So what we now know is that there's a combination of states with high seroprevalence, but also a very high undercount, which means that they missed anything between 80 to 100 or even a little more cases per clinically diagnosed case versus states which actually have done very well, which means they have low seroprevalence plus a low undercount, the best being Kerala, where they missed only 6 cases for each diagnosed. Now, all this is relevant because those are the states with relatively low seroprevalence, Kerala and to a certain extent Maharashtra, who are now experiencing, or rather who continue to experience, what could certainly be called the tail of the second wave.
Now, to date, India has administered over 744 million doses of a Covid-19 vaccine, but there is still a certain hesitancy among people to go and get a jab. Just why is that?
Well, the fact is that there were periods of hesitancy, but now it certainly gathered a lot more momentum than what it was, say, 2 or 3 months earlier. To the extent that the daily administration of vaccines have gone up to even 10 million on several days. Now, while that's really positive news, there are still areas of inequity, one of them being rural-urban differences. The rural areas are now picking up. The other also is gender, with substantially less number of women being immunized than the number of men. So these are areas which still need more attention, and therefore India needs to find this balance between speed and inequity.
And alarm bells are, of course, set to ring once again in the coming weeks across India with a string of big religious festivals in the calendar. Just how dangerous could these events be when it comes to COVID-19, in your opinion?
Well, as things stand, both the federal government as well as the state governments are trying their best to be able to have a more low-key celebration so that there aren't any huge surge of cases. And a series of advisories have been put out, but that's easier said than done because these are festivals involving very, very large populations. And therefore, it's not just a series of SOPs or advisories or do's and don'ts, but also how effective communication strategies are going to be and how much cooperation and adherence we receive from the communities as well as the religious and social leaders. It's all going to be a combination of these various things. But I recently came across a very poignant message in Calcutta, where I was a couple of days ago, which is also gearing up for the festive season. It simply said, this time it's worship and not festivities. Clearly, that's a very poignant message, and I hope really this makes sense.
Okay, Rajib Dasgupta from the Centre of Social Medicine and Community Health in New Delhi. That's all we have time for. But thank you very much for joining us here on France 24. Thank you so much.